Lynn Szabo, Redwood Urgent Care. Time now for this week's Health Matters, and you've got smoking on the agenda.
Yeah, smoking's a big problem up here. Not only is it one of the leading causes of preventable deaths, with over 500,000 people dying a year from smoking-related health issues, and the average smoker losing about 13 to 14 years off their life.
Wow.
Yeah.
Now, statistically, they lose that much, even if they don't die from something that is caused
Right.
specifically.
Exactly.
That's just attrition.
All-cause mortality, yeah.
Wow.
And sadly, women 14, men 13 is the loss. There's some kind of gender disparity there. But anyway, death from vascular problems, lung cancer, heart attacks, constrictive obstructive pulmonary disease, tooth loss and decay. There's not a lot of people that have died of that, but it's certainly disfiguring and contributes to poor health in general.
Mm-hmm.
It's also a risk factor for Alzheimer's, and when pregnant women smoke, a big deal up here. They're thinking that the offspring of a pregnancy where smoking happened, there's a risk factor for ADHD, so attention deficit hyperactivity disorder.
Wow.
So, yeah. The reason it's important, the data that I saw from 2014 says that Del Norte smoking rates are about 2 times higher than the rest of California, and they're going up really fast.
Going up.
They're going up. Yeah, it's very bizarre.
That is bizarre.
We're bucking the trend, but not in a good way. Also, Del Norte County has a higher death rate in general from all-cause mortality, and they're looking at that to see if that's part of the problem.
Mm-hmm.
Although I think what they're going to find there is that there's a lot of factors that the death rate is higher here, not just smoking. So,
Do you have percentages? Did you find anything like that? What's the percentage of smokers in Del Norte County and the state? I don't know. Last time I heard.
the state's about 12%. Del Norte's about 21%.
Wow. Okay.
Yeah, so it's close to twice.
Yeah.
Yeah. So how do you quit? So I don't like lecturing people. But they do say that one of the most inspiring ways to get somebody to quit is when their healthcare provider says you need to quit. And so I try and say that to all smokers. I also ask all smokers, even kids, if they smoke. I have found 5-year-olds in this county who smoke. I have found 7-year-olds to be a little more common. And if I ask the kids directly, they're usually pretty truthful about it.
Wow.
Yeah. It's really sad.
Now, there was something I remember from back in the 90s, and it was the first time I'd ever heard this, and I want to ask you if it's still true. But back then, I think when Coop, or just after Coop had been like a Surgeon General, right? It came out, they compared quitting cigarettes and nicotine was as hard or harder than heroin.
Yeah, I think that's probably true. That is something that's commonly said, but I think it takes about 9 serious attempts for a smoker to quit.
Wow.
And I think what I'm going to be talking about here is how to optimize people's ability to quit, because I think people really do want to, but I think they're kind of trapped in it, and they really don't know where to get resources. I mean, as healthcare providers, we just say you shouldn't be smoking, and then oftentimes the conversation ends there. And there really is some things that are data-driven that can be helpful.
Okay, well, what's the next part of the conversation?
How do you quit? Well, 3 to 6% of all quit attempts are successful. And it takes about 9 times, the last data I saw, it takes about 9 times serious attempts to quit.
Wow.
The most common one, but the least successful strategy, is cold turkey. And for people that do cold turkey, there's like even less than 3%. Even after a month, almost nobody has really been successful.
Oh, wow.
Although occasionally you'll hear about somebody who's just like ready to quit and they just walk away and it works for them. But that's probably the most common because it kind of utilizes the least support. But because there's so fewer resources to help somebody get through that, it just doesn't work as well as you'd think. So medications are helpful. And the first one that people are often offered is nicotine replacement. So things like patches, gum, or lozenges. About 93% of people who use that relapse within the first year.
Wow, okay.
And that's not really quitting nicotine.
Yeah, exactly.
That's like
changing.
transferring addiction. So I think that's trying to get rid of the smoking behavior, but it's still, the gum still causes the same kind of problems that we referenced previously as far as health issues.
Now, you raise an interesting point there, because that's, I mean, you are just basically changing the delivery system when you supplement yourself with nicotine like that. And everybody knows, of course, lung cancer and what smoking, the act of smoking, does. What is it that nicotine does?
Do you mean as far as why do people need it?
Why is it bad for you?
Oh, why is it bad for you? I think that it causes problems with peripheral vascular disease. That's why stroke risk is up. That's why heart attack risk is up. That's why wounds don't heal. That's why peripheral vascular disease happens and people start to have problems getting blood supplied to and from their legs, things like that. Okay. And I think it probably does other things. I didn't research that too completely, but I do know the absence of nicotine makes people miserable if their body is used to having it. And that's one of the things as far as medication. Not only are we looking at something that will make people actually give up the cigarettes, but we're also looking at something that makes them less miserable where they're trying to do it. So the next medication, bupropion, I go by the name Wellbutrin.
Okay.
There's an increase, it offers an increase in long-term success, but again, it's not as available. You have to go to a provider to get a prescription for it, and you risk some side effects, mostly anxiety and agitation, but the most significant one is it can lower the seizure threshold.
Oh, wow.
So people can get seizures from being on that medication. And I don't want to scare anybody away now that I have. It is a good tool, it is helpful, but it is not something that's easily available. And it, even though it helps somebody, it really might not have access to that. So the next thing is Chantix. I'm not even going to attempt the generic name. It does, however, work really well.
Really?
Yeah, it doubles,
I've seen the commercials. I wonder. Yeah.
It doubles the chance of quitting.
Wow.
And and not only in quitting like in the first month, which is where most of this data comes from, but actually after 6 months, a lot of people are still off of it. So the problem is that there's concerns about the side effects, and in the beginning there was some concern that it would cause people to have psychological problems, and I think suicide was brought up as a black box warning, but there's been some newer studies that suggest that might not be true.
Now, with medications like Chantix, do you need to stay on it for a prolonged amount of time? Is there a time when you go, okay, I've stopped smoking, I can stop this?
Right, and even though it's really, really good at decreasing the withdrawal symptoms, it's again, you have to go to a provider to get it. It's expensive, and you have to be on it for a long period of time. Okay. So the other thing is they have some concerns about cardiac risk with it, and they're not really certain if it contributes to cardiac problems or if it just happens to make existing problems worse. So the data aren't really in on that one. But again, works really well. Unfortunately, not an easy resource to come across, and there might be reasons why somebody shouldn't do it. But I think if you're looking at overall risk of any of these medications, the risk from the nicotine, and the other things that are in cigarettes, it's just not nicotine alone, way outranks the risk of these medications. So it takes, one thing that's interesting, people often tell me they're non-smokers, that they quit smoking 3 days ago or 1 week ago.
You're not a non-smoker.
Yeah, you don't, but you don't get to your new normal for 16 years.
Wow.
Yeah.
Now, how do they measure that? What do you mean by, how can they tell you're not back to, is it just levels of things?
And they're looking mostly at cardiac risk.
Okay.
So your risk of stroke goes down probably in years. Your improvement of your peripheral vasculature probably improves within days. But as far as your heart, it doesn't really get to its new normal for about 16 years, they say.
Wow, my gosh.
Big deal. So cutting down to quit, this is a strategy that happens a lot up here because you can kind of control the withdrawal a little easier, and it doesn't take resources. You don't have to go to your provider. You don't have to. You'd actually be saving money. There's two problems with that. Works as well as cold turkey does, so it's not really a very effective way. And they think that when people are smoking fewer cigarettes per day, they're actually inhaling the smoke more deeply, and they're increasing their exposure to the known carcinogens in cigarettes. So it does work, though. It just doesn't work super well.
Yeah.
So,
I've heard a lot of things recently about secondhand smoke, and that was it seemed like it. I mean, it's a big deal now. I can remember being a kid and sitting in a smoky room, and even as a child, going, "How is this okay?" What's the truth behind that? How much should people be concerned with the?
they should be really concerned. Any household that has a smoker and a child living there, they should be really clear that smoking needs to take place outside. And I talk about something called the 15-minute rule. Center for Disease Control has some data showing that it takes 13.9 minutes for the lungs to clear all the toxins out. So after you're finished the last puff, 13.9 minutes, I usually say 15, because we tend to round down. And people will be very diligent about washing their hands or changing jackets and stuff, but that is not nearly as important as actually staying outside for 15 minutes after the last cigarette.
Because you're still breathing smoke then.
Yeah, then you're going to be bringing this, you're like a little bucket bringing the smoke in the house. The other thing is that the furnishings inside the house actually off-gas cigarette smoking. So oftentimes I'll hear grandparents smoke in the house until the grandchild shows up, and then they start smoking outside for a little bit, but they don't realize that there's off-gassing, and sometimes that is going on for years.
Yeah.
There's even people, they have some data to show that people in like apartment buildings, if there was a smoker that lived in a neighboring unit, they still have evidence of the toxins in the smoke in the unit where the non-smoker lived, even up to years after the smoking behavior stopped.
Wow.
So it's a big problem.
It's a big deal. And imagine what it does to a room, and then imagine what it does to your body.
You can't wave your arm and have it all go away. So. But,
all right. So there are all these problematic ways. What's the best way? What can people, especially here in Del Norte County, where maybe there might be less access to resources, what can they do?
Well, their primary care provider can be really helpful. So some of these medications, if they sound like they might be right for you, or if you had success with them in the past, definitely go talk to your primary care provider. Set a date. Make a plan. So about this time of year, I start talking to people about, hey, New Year's resolution. Start thinking about it. Get your ducks in a row. Get the support you need. You could make this real. And some people actually really responsive to that.
It's you make it conscious. Then
Right.
it becomes a conscious thing. If
And
you're
it's
playing.
also not. There's some time to plan, to get used to the idea, to think about how you're going to do it, and to feel supported. And then you can, instead of waiting till 10 minutes before midnight and going for it.
Yeah, having your last cigarette at the New Year's party, right?
Exactly. Yeah. Best help, 1-800-NO-BUTS. Smokers pay for this as part of the taxes that they pay when they buy cigarettes.
I had no idea, really. Wow.
Yeah,
Okay.
yeah. So I tell them to go ahead and call them up and get that. It's a little bit of a hassle because, you leave times when you can be at the phone and they call you back and you have some counseling. The data show that this kind of counseling really increases somebody's ability to quit. And for Spanish speakers, it's 1-800-45-NO-FUME, which is 1-800-456-6386. And they have a special line for teens. I didn't know that.
Wow.
Teen smoking, big problem in Del Norte County with these cigarettes and vaping. For teens that want to quit, 1-800-662-8887.
I see down there on the paper you've got TUPP also written. That's a big organization here in Del Norte County.
Yeah, and I've got their phone number, 464-3191, extension 2831, and there's a Facebook group, Tobacco Free Del Norte. I don't think this is going on, but 12-step programs sometimes have Nicotine Anonymous, and I think a 12-step program might be really helpful, just because it seems to be working for people with other addiction issues. And I think the 12 steps are mostly just rules for living, right?
Yeah,
Yeah.
that's true. But it's good to go through that sort of experience too, with all the support of the group and people, and also it makes it very conscious to go through something like that.
Right, and ongoing support, because this is not 3 days and you're done. This is like an ongoing battle. Yeah. So I know when I smoked briefly in my early 30s, which is about 30 years ago, and I still think on a Friday night sometimes I could stop by the gas station.
Wow.
My kids would never know. You know, I still feel that little monkey on my back. So I understand that it's not easy to give up, but it is really important, not only for our individual health, but for the people that live around us, and most especially for the kids.
Exactly. Lynn, thank you very much.
Yeah.
Words of wisdom and rules to live by. Right there. Wait, I think we just came up with a tagline for this. Words of wisdom and rules to live by.
Right on.
Health matter. Any idea what next week will be?
Yeah, I'm actually thinking about addressing the opioid thing and how providers played into it and how Big Pharma might have played into it and some of my own observations. I think that if anybody has any questions they want me to look up directly, I'd be glad to. But it's a complex problem, and it's really, really tragedy in this county.
And there have been some lawsuits and indictments recently too, right?
Yeah,
Yeah.
probably well deserved.
Lynn Szabo from Redwood Urgent Care, thank you very much.
Thank you.